Indomethacin Submicronized 20 mg capsule is used to relieve pain, swelling, and joint stiffness caused by arthritis, gout, bursitis, and tendonitis. It is also used to relieve pain from various other conditions. This medication is known as a non-steroidal anti-inflammatory drug, Nsaid. It works by blocking your body's production of certain natural substances that cause inflammation. This effect helps to decrease swelling and pain. If you are treating a chronic condition such as arthritis, ask your doctor about non-drug treatments and/or using other medications to treat your pain. It is important to follow your doctor's instructions for the proper dosage and timing of taking this medication. Before starting to use indomethacin, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually 2 to 3 times a day with a full glass of water. Avoid lying down for at least 10 minutes after taking this drug. If you experience stomach upset, take it with food, milk, or an antacid. The dosage of indomethacin is based on your medical condition and response to treatment. In children, the dosage is also based on weight. To reduce the risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or use this drug more often or for longer than prescribed. For ongoing conditions such as arthritis, continue taking this medication as directed. In certain conditions, it may take up to 4 weeks of regular use before you notice the full benefits of indomethacin. If you are taking this drug on an as-needed basis, remember that it works best if used as the first signs of pain occur. Be sure to tell your doctor if your condition worsens. If you experience upset stomach, heartburn, headache, drowsiness, or dizziness, it's important to let your doctor or pharmacist know. It's also important to monitor your blood pressure regularly as this medication may raise it. Be sure to report any serious side effects to your doctor, such as changes in hearing or mental/mood changes. Additionally, seek medical help immediately if you experience symptoms of liver damage, signs of kidney problems, or a serious allergic reaction. Always consult your doctor or pharmacist if you notice any other effects not listed here. If you are in the US, you can report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Indomethacin Submicronized 20 mg capsule, a non-steroidal anti-inflammatory drug, may rarely increase the risk for a heart attack or stroke, especially if taken for a long time. The risk may be greater in older adults or those with heart disease, high blood pressure, or diabetes. It's important to avoid taking this medication right before or after heart bypass surgery. Additionally, this drug may rarely cause serious, rarely fatal, bleeding from the stomach or intestines, especially in older adults. It's important to be aware of symptoms such as stomach pain, black/tarry stools, or vomiting that looks like coffee grounds and seek medical help immediately if any of these occur. It's important to talk to your doctor or pharmacist about the risks and benefits of taking this medication, and to seek medical help right away if you experience any serious side effects such as abdominal pain, unusual sweating, weakness on one side of the body, sudden vision changes, or trouble speaking. Before taking indomethacin, it's important to talk to your doctor or pharmacist about any allergies you may have, and to discuss your medical history, especially if you have asthma, bleeding or clotting problems, heart disease, high blood pressure, liver disease, or stomach/intestinal/esophagus issues. Kidney problems can sometimes occur with the use of this medication, and it's important to stay hydrated and report any changes in urine output to your doctor. Indomethacin may cause dizziness or drowsiness, so it's important to avoid alcohol and marijuana, which can increase these effects. Use caution when driving or using machinery. This medication can also increase the risk of stomach bleeding, especially when combined with alcohol and tobacco use. Before having surgery, be sure to inform your doctor about all the medications and herbal products you are using. It's important to limit sun exposure while using this medication, as it can make you more sensitive to the sun. Wear sunscreen and protective clothing when outdoors. Older adults may be at greater risk for certain side effects, and children may be more sensitive to serious liver problems. Women who are pregnant or planning to become pregnant should discuss the risks and benefits of using this medication with their doctor. It can harm an unborn baby and should not be used after 30 weeks of pregnancy. This medication also passes into breast milk, so consult your doctor before breastfeeding. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Also, be sure to check all prescription and non-prescription medicine labels carefully. Some products that may interact with this drug include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, methotrexate, and water pills. This medication may also increase the risk of bleeding when taken with other drugs that may cause bleeding, such as antiplatelet drugs and blood thinners. Be sure to talk to your doctor or pharmacist for more details. It's also important to be aware that this medication may interfere with certain lab tests, potentially causing false test results. Make sure you inform lab personnel and all your doctors that you are using this drug. If you or someone you know has taken too much Indomethacin Submicronized 20 mg capsule and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include severe stomach pain, vomit that looks like coffee grounds, extreme drowsiness, slow or shallow breathing, confusion, and seizures. It is important not to share this medication with others. Your doctor may also recommend lab or medical tests, such as blood pressure, complete blood count, or liver/kidney function tests while you are taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. In addition to taking this medication, your doctor may recommend non-drug treatments for arthritis that are approved, such as weight loss if needed, strengthening and conditioning exercises. These non-drug treatments may help improve your flexibility, range of motion, and joint function. It's important to consult your doctor for specific instructions on these non-drug treatments. If you are taking this medication regularly and happen to miss a dose, take it as soon as you remember. If it's almost time for your next dose, then just skip the missed one and take the next dose at the regular time. Remember not to take a double dose to make up for the missed one. When storing Indomethacin Submicronized 20 mg capsule non-steroidal anti-inflammatory, Nsaid, and salicylates, make sure to keep it at room temperature, away from light and moisture. It's important not to store it in the bathroom and to keep it out of reach of children and pets. When it's time to dispose of this medication, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Make sure to properly discard the product and it is expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.